I have to say, I'm in a pretty good mood this evening, but my head is hurting at the impact site. And you know what? It's not psychosomatic that I'm actually feeling it. But there's pain emanating from there, and I've been talking about this for some time. And on the MRIs of the with contrast and without contrast in the of the head, there's one still where there's an actual like weird looking dent in my head. And I don't understand how that got past anyone. I don't think that's normal. I look at that and I go, okay, that's not right. Um, and so I'm wondering if there's, because I've heard some bad stuff about the company that I was using, and I've heard good stuff. But I mean, I'm concerned that there's more extensive damage there than I, like when I was told by the doctor that there was just a little bit of hyperintensity white matter, and like and didn't even they were when I went and got the reports. I'm sorry, I'm having allergies and my nose is driving me crazy. Um, uh, when I went and actually got the reports to go with the MRI and the CAT scans, I was shocked at some of the language. Like there was a spot on my liver, most likely benign. Guess what? The biological male donor, aka father, died of liver cancer. And they know that. It's in my records. But they never think to go, oh, maybe we should have a closer look at that. Knowing that I'm so, like I not just the head injury stuff, I have other stuff that's going on, that actually had me physically hurt, and I'm wondering if there's just something going on with like something in the brain. I'm really concerned because it hurts, and my short-term memory is pretty bad when it's being tested at a certain level, and I'm you know I think there's been more damage here than it's being recorded, it's not being diagnosed. And I think it has something to do with the health facility that I was using. Some people love them, but here recently, Anthony's been with them for a really long time. And then for some reason, here recently, in the last like maybe 5 or 10 years, they've just kind of become more dangerous, not diagnosing things properly in other people off of x-rays and MRIs and other imageries and other things, And so my head is actually like really hurting me and my ears are ringing really loud. And, but the spot actually hurts. Like today when I went to touch it, cause I guess it was hurting, I went to touch it and it actually hurt physically. So I was like, oh, okay, now that's not psychosomatic. That's physical, topical. And it's hurting. And I don't know. I think I need to have my images looked at by somebody who knows what they're doing, who's really looking out for me, you know, because I got a feeling those people did not diagnose that properly, and for the doctor to not even tell me about the spot on the liver, and then to say that there was a little bit of hyperintensity, but not much. It's like that's okay. If you have hyperintensity white matter from a head injury, you've got problems. That's not something that you shove under the rug. And I think there might be damage in there that's just kind of like continuing along because it ebbs and flows. But I mean, I have a lot of different issues from my head injury, and so I don't know. And something else. Oh my gosh! And something else in my medical records and the MRI. I think I may have put this in one of the older videos when I actually talked about the MRI images that I just got recently. Well, there's a PDF flyer or something in my MRI of the head and the brain about TBI and sleep apnea. And when I was hospitalized, one of the nurses were like, "Okay, we need to look at the sleep apnea thing." Well, I keep waking up at like 3 o'clock in the morning, around 3 o'clock in the morning, and it's like my chest and my arm hurts. My right arm hurts like right here. And the thing in the PDF and with the MRI images was TBI and sleep apnea, and I was like, oh my gosh, because when I was hospitalized one time, it was a couple times when I would sleep, my oxygen thing, my whatever would go off, the monitor on my finger, it would say that my heart stuff was all off and it would like make a lot of noise, and they would come in there and they asked me if I had sleep apnea, and I was like, I don't know, you know, and but yet my doctor didn't talk about this kind of stuff with me. I mean, I am compromised as a head injury person. I mean, I'm not within 100% of being able to make sure everything's done properly. Like, you know, I should have immediately asked, but now I need to find all new doctors, and I'm just burnt out right now because of what I was hospitalized for. I just feel like zapped, actually. I do. Um, because it was so much. I mean, struggling with the brain injury stuff and struggling to get the MRI images. I mean, it was a year and a month, or August, September, a year and a month after I hit my head, my closed TBI, did I get my MRI images done. No, that was a CAT scan. It didn't show anything. My MRI images weren't done until March, February, January the 9th. Hey, look at me go. See? January the 9th. So you can't exercise the memory. That makes me feel good. I believe it was January the 9th. I'm pretty sure. But yeah, so that's more than a year and a month. That's, you know, like a year and a half almost. So that is not good. I think there's something going on over here. Active. Undiagnosed. Why would the one image of my MRI show like a flattened, and it's like oh god, it's like the door that I hit. It's the end frame. It's the square thing. I was like, oh my god, it's like just square like that. It's square. And I saw it and I was like, what the hell is this? It's almost like they didn't even look at this image. There's no way they can tell me that's normal. Like, why isn't the rest of the head, why isn't anything like that show up anywhere else, but it's right in the same area where I hit my head? So, I don't know. But it does feel like something's like active in there. I mean, I think at this point, I'm somebody that the medical system has failed. I mean that genuinely for my head injury, for sure. For sure. Hands down. Starting with ER physician, you know, on 5 days after the injury. See, I should not have been making any decisions like that for myself. That really bothers me that I was the head injury victim, yet I was making medical decisions for myself. See a little problem with that? I should have been in the hospital. If anyone in my family, like my sister or my nephew, anyone who's ever cared for me would have seen the state that I was in that night, they would have called 911. I would have been at the hospital that night. Just the state of me, you know, losing consciousness twice. So, yeah, I'm a little worried right now. I kind of feel like the medical, not kind of, I know it has. I mean, I, mm, mm, mm. And I already had the pseudotumor cerebri, false tumor of the brain. So my brain was already acting like there was a tumor on it. I'd have optic nerve swelling, and that could cause me to lose my vision. And here I am, a closed TBI, lost consciousness twice, very shortly after the impact. I didn't have an MRI for a year and a half. And I don't feel like it's like getting better. I do not feel like that. I'm seriously concerned about dementia and slipping off. I really am. Because there's no guarantees, and I know I feel off base. I know I feel off kilter, like, am I sliding? And I've talked about this since last year when I started really tracking the symptoms, because if you remember, see, I've actually gone back over some of my videos from last year and I watched them to just refresh my memory on what was happening to me, keeping up with it, because there's kind of a lot of stuff I just don't remember. And so anyway, what what was it? Oh, I was getting dizzy when I stood up, or I could just be standing up. And this happened for 2 or 3 days. I would just all of a sudden feel like I was going to pass out and like start almost like losing, and I would sit down very quickly. Thankfully, I'm strong physically and I can navigate myself pretty efficiently. And I'd get myself sat down into a seat and then just sit there, until it passed. And it would pass in a very short period of time. But it was like I was passing out just for no reason. And that happened like a number of times throughout the day for 2 or 3 days. And I was just freaking terrified. And the freaking doctor, excuse my language, really, I'm so sorry, but I'm telling you, these doctors did not understand the urgency of what was happening to me. They treated me like I was a mental patient. I'm like, you are not getting this. This is not a mental health issue here, okay? I was not like this before the head injury. Now I have this head injury. Now I have these problems. This is a direct correlation. Don't treat me like a mental health patient. Let's get in there and physiologically find out what has happened. And it took me a year and a half to get my MRIs with contrasting dye. And I had started seeing a doctor last year in May 2014. Got my MRI. Head injury, August 24th, 2013. Started seeing doctors May 2013. Did I say 2013? August the 24th, 2013 is when I hit my head. May 2014 is when I started seeing physicians. And I spent all freaking summer just in a state of panic trying to get them to listen to me that this was not right. This was not me. This is not who I am. This all started happening after the TBI. And I still haven't got the attention it actually deserves. A professional who actually is going over as far as the medical, there's been a definite, and I do feel like I'm in a slide. It does worry me because the short-term memory, I can't gauge if it's getting better or worse, but it certainly doesn't feel like it's getting any better. That's my opinion of it. Now, I am able to recall things. I don't lose 100% of everything, obviously, right? Then I would probably truly just be flipped out. But this right here is, it's enough that I'm very unhappy. I'm not happy with the memory loss stuff. It's hard. It's hard for me to accept it, even though I know it's been happening for a long time, and the goal is acceptance, and the goal is to understand what's happening to you. But I got to tell you, I'm having a difficult time accepting the memory loss stuff. How I described it, and this is just, I was tested recently, and by the end of the 3 tests, that each were about an hour long, and so they were these, certified, tests for memory given by a physician, doctor. As I got further into the test, the short-term memory, I struggled more for not just memory, but just trying to remember anything, and I grew very frustrated, and it upset me very much. And it was demoralizing to me because I used to excel at any test, and especially when it came to memory. And that's the thing that I think everyone keeps saying, oh yeah, like the normal memory, but my memory was actually really good. I mean, I'm not saying that as a biased. I'm saying I was known for my memory. Everyone, like most people, would be very annoyed with me because I could actually give dates and times 30 years, 40 years back, long time back. But now, I mean, who knows what long term is gone, because there's no one to remind me of my history other than what is in my mind. And then the short term stuff that I just hear, oh, you've already told me that 3 times now, 4 times now. And now I'm getting, I think, up to like 5 and 6 times on some things. I'm like, and I don't, half the time when it's like stuff like that, it doesn't bother me as much. But when I was being tested and I felt myself struggling, and then I became just quite upset that I was doing just I know I have short-term memory problems, but I don't want, I guess, just to see it quantified. I mean, to me, when you're being tested, and someone's in front of you, I'm so used to excelling at tests, and to have it to be quantified that, wow, your memory is absolute crap in some regards. I mean, it really was. I just, once we got to the third test, and I was really upset by my lack of being able to remember these, these little tiles with kind of like artwork or whatever, lines and circles and stuff like that, squiggly lines. But it was, I think some of the stuff I did good on, I think, but when I started that third test, that third hour of testing, and I guess I learned today that, and I probably knew this, but I probably forgot, because I know that Patrick probably told me this in the support group, but that the brain will also get more tired and more exhausted. And it's a heavier kind of exhaustion. Like when I left the exam, I was so demoralized. I felt, and I couldn't hardly think. I mean, I was just like, all I wanted to do was just get home. That was it. And I didn't want to have to think about anything, nothing, just please get me home. It was really, really tough on me. And it's still affecting me. And this happened on Monday. And I still spiritually feel affected, but not as heavy hearted as what I was on Monday and Tuesday. I was just so heavy hearted. Because for me, that is quantifiable. And I just sat there like, I couldn't, I just couldn't believe that it. I mean, like I said, I know it's bad. I think it's one thing to say, oh, my memory's bad, ha ha ha. But when I'm failing tests, that are markers of memory badly, I'm failing these tests, man, that wasn't me. And so, like, it becomes more quantifiable at that point. This is, now you got someone, it's measured. It's being measured. And now I want a bunch of these tests done. I just want as many tests done as I can. I just would like to know now. Yeah, I guess I do kind of feel like I need to have more, so I can know. See, that's what I'm saying. I'm worried about dementia. And the hyperintensity of white matter leads to early dementia. And I can't seem to impress that upon my medical doctors. And I don't understand. I don't understand. It's not a neurosis. This is happening to me. I am this human being who deserves love and respect and proper medical attention. I deserve for someone to stop, look at my records, and go, "Wow, we really just have to sit down and get you straightened out, don't we?" And people are trying. I got a couple of good people who are. I'm really thankful that they're. I'm in their circle or they're in mine, whichever. But it's challenging, but it's a bigger challenge because I'm doing it for myself, and that makes it so much harder because I'm the one who's trying to advocate for myself. I'm the one who has a very strong feeling that I'm not being properly medically treated for the head injury, and you can't say that I am when I have a doctor who doesn't even talk about the spot on my liver, though it's in my medical records that the biological male died of liver cancer. But assigning me or prescribing me contradictive medications that I actually have to argue with her about to get it straightened out, that no, this is not what you should be prescribing. So, I just don't understand the failure in the medical treatment at all. I really don't. And I do feel it is my responsibility to go find a new doctor, but that's challenging. I'm going to go. This is almost 20 minutes long, but I feel so frustrated because I'm actually feeling physical pain over here. It's not phantom in the least. I mean, it's on my, it's like, it hurts. It's very tender, and so it's like, this is not right. I don't know. I don't understand. Okay, I'm going to go. Take great care. This probably sounded more fussy than what I meant for it to be, but I'm challenges right now. And I'm going to stand up to those challenges. I'm not going to be, um, I'm not going to be thrown off track, and I'm not going to be stopped. I want proper medical attention. I don't want to give up on the system. It is getting exhausting right now. My ears are just driving me crazy. And I think it's because I do feel pressure or stress to try and find a doctor. And it's exhausting. I mean, it truly is, because this is like the third, oh, this is the third doctor. Well, I just left the third doctor. And the first doctor probably wasn't that bad, but it was a male doctor, and I was trying to, I don't know, I was trying to have female doctors just to, because I've always had male doctors. I was like, I'll try female doctors because I'm an aging woman, and I'm going to have hormonal issues, and there's going to be lots of stuff. And I know that male doctors are educated, but I just thought that a female doctor would be better at empathizing and understanding, oh yeah, you're going through that, okay? Because, I mean, I'm an aging woman. There's going to be things that I'm going to be experiencing, and I would like to have great medical care, great whatever, understanding, empathy, feedback. I mean, I don't expect my doctor to hold my hand and coddle me, but I do. I also don't expect my doctor to prescribe me contradictive medication. And I have to argue back and forth in writing. I'm just sorry, I can't. And like I said, I think I feel let down right now about the head injury stuff. And I feel like, that the system is not working very well right now. And I don't mean to complain about it, but it really, I mean, I have a trail of records, so it's not my opinion here. I'm not just making this up. I can actually show this. The ER doctor patted me on the hand and told me I was fine, and I was terrified in that ER, having had every symptom that a head injury person has that's considered dangerous, practically, other than vomiting. Everything else, all of it, losing consciousness, garbled speech. I could barely write. You should see the note that I wrote him to make sure, because I was, I knew that my mind wasn't right. I wrote down this list of things that I had been experiencing because I was trying to help myself as much as possible. And he didn't even do an x-ray. I mean, I got that paperwork. It's their paperwork. It shows what they did or did not do for treatment. And I was messed up. Garbled speech, unconsciousness. And now I just feel like, I've gotten, that it's here, it's on me, and I'm struggling with it. And it's more lasting than what I thought it was going to be. I didn't, you remember neuroplasticity and work that memory, and I am working the memory. I am still doing those things. I read a lot of news every day. I'm doing things, but sometimes I feel so fogged out, and it's just my brain. It's the injury, pain. So yeah, I think right now I'm having a moment. I think I'm having a moment of, not pleased at all. I mean, at all with my medical treatment. I mean, it's almost unbelievable. And it's not me being fussy, I'm telling you. It's not. You think me being prescribing contradictive medications, that's not fussy, I assure you. So it's kind of weird, like, what's going on? I'm not too happy right now, and I feel like I need better medical treatment. So I'm gonna calm down. I'm not really upset, but I think I'm kind of hurt that I'm the patient, like, in how I feel right now in my head, like how it's hurting and how my whole body, I don't want to be the one who's sitting here going, I gotta advocate for myself. It's just tiring. It's all tiring. I don't want to keep going to doctors, but yet I think if my doctors would have prescribed me properly in the first place, had the MRIs early, proper reading of the MRI, proper rehab, proper in the very beginning when I injured myself in 2013. But it's just none of that. And I just feel like I'm sitting here. Sometimes I feel like I'm sliding because of the head injury. And that by the time I get the attention that I need, I will have gone too far. I'm so worried about that. Hyperintensity with the dementia and the pain that's imminent. I mean, what is going on in my head that's not being properly cared for? I've done everything I can. I put everything in writing. I've talked to everybody that was my physician, telling them, hey, you know, I have an appointment coming up, but it's with the neurosurgeons, which I'm not in there for surgery. It's just they're, specialist in this area here in the head. But it's at the facility that I no longer want to work with and I no longer trust. And I need to see this specialist. So I don't know. I'll probably go to the appointment. I'm thinking like how I feel right now. And this person is a neurosurgeon. I mean, that's where I belong. So I'll probably keep the appointment, but it's exhausting, Okay. Well, I hope that you guys are doing fantastic. I've been really going on here for 25, almost 26 minutes now. Have a great night. Take great care of your heads. Head Injury Jane here. Have a good week.